female. The male starts out with, you've got, bladder, seminal vesicle, prostate gland, scrotum, testicle, epididymis, spermatic cord with vas deferens in it. So this is the spermatic cord, this is the vas deferens. You have spermatic veins and arteries. You have scrotum, you have the penis with the glands, and there would be foreskin here. Turning it over, you have bladder, pelvic bone, prostate gland, urethra. You have corpus cavernosa, which is an erectile tissue, and corpus spongiosum, which is an erectile tissue that surrounds the urethra. These erectile tissues help with erection. They fill up with blood, and that's what causes an erection. Then you have vas deferens and ureter. You have the common ejaculatory duct, and then urethra. Here you would have the seminiferous tubules in the testicle. The sperm are produced in the seminiferous tubules in the testicle. They mature in the epididymis. They go through the spermatic cord in the vas deferens. They join with the seminal vesicle and become the common ejaculatory duct. Then the vas deferens and the common ejaculatory duct become the urethra and then out. Okay, so that's your meow.
Can you push that down that way? Can you push that down more?
You have female. You have your uterus, bladder, urethra, cervix, vagina, clitoris, rectum and anus. And looking at it this way, you have uterus, bladder, clitoris or clitoris, the labia. You have a fallopian tube, fimbria, and ovary. And there are 2 ovaries, 2 fallopian tubes, 2 fimbria, and infundibulums, which is the funnel. You have ureter, fallopian tube. This is a ovarian ligament here. This is the ovary, fimbria, fallopian tube, uterus. The uterus has the cervix, and then the cervix connects to the vagina. And this is the vaginal orifice. The bladder connects to the urethra and to the ureters. And this is the urinary orifice. And this is the pelvis, rectum, and anus. Okay, that's the female. I don't know how. Okay.
So
Then we have the 7-month-old baby, fetus, umbilical cord, placenta. Oh, this is the placenta. We have, the whole thing is the uterus.
you said this was the placenta.
This pad of tissue is the placenta. Okay, this is the chorionic villi. There are 3 layers to the uterus. You have the endometrium, the myometrium, and the perimetrium.
We need to know that?
You need to know the layers, but I won't ask you the layers on this. Then you have the cervix and the vagina. Cervix. This would be the internal os, and this is the external os. When the baby's ready, that kind of all squishes together as it dilates, so you don't have such a cushiony cervix. And then you have the uterus, the ovarian ligament, the fallopian tube, fimbria, and ovary. Ovarian ligament, ovary, fallopian tube, fimbria, uterus. And that's what you need to know about the baby. Okay?
Thank you.